Duodenal endoscopic submucosal dissection is feasible using the pocket creation method. Introduction. Endoscopic submucosal dissection (ESD) has been recognized as a standard method to treat superficial tumors in the alimentary tract. Recently, the ESD technique has been widely applied to the treatment of lesions in the colon, esophagus, duodenum, and stomach. ESD of lesions in the duodenum is more difficult than ESD of lesions in other parts of the alimentary tract, with a higher rate of adverse events. These difficulties can be explained by several characteristics of the duodenum. 1. A thin, soft muscularis. 2. The presence of dense Brunner's glands in the submucosal layer. 3. Poor submucosal elevation following injection. 4. Rapid dispersion of injected solution just after the mucosal incision because of the coarse submucosal layer. 5. Poor opening of the incised area after the mucosal incision. 6. Difficult maneuvering of the endoscope due to a redundant loop in the stomach. And 7. The need for a vertical approach to the muscularis, especially in the superior and inferior duodenal angles. Previous reports of endoscopic treatment of superficial lesions in the duodenum have focused mainly on patients treated with endoscopic mucosal resection, EMR, and the number of patients treated by duodenal ESD is relatively small. Endoscopic en bloc R0 resection of duodenal lesions may obviate the need for an invasive resection, such as a pancreatoduodenectomy. The authors performed duodenal ESD without limitations regarding the size or location of the lesion, and their institution has been a pioneer in ESD throughout the alimentary tract. Miura et al. Recently introduced a new technique, the pocket creation method, PCM. The main feature of the PCM is the creation of a submucosal pocket under the tumor using a small caliber tip transparent hood. The introduction of the PCM has the potential to overcome difficulties associated with ESD for tumors with severe submucosal fibrosis and in difficult locations. Background and aims. Duodenal endoscopic submucosal dissection, ESD, requires sophisticated endoscopic techniques because of a high rate of perforation. Miura et al. Introduced the pocket creation method, PCM, of duodenal ESD to overcome difficulties. The aim of this study was to evaluate the safety and usefulness of ESD using the PCM for superficial tumors of the duodenum. Patients and methods. Miura et al. Performed ESD of 17 non-ampullary duodenal lesions using the conventional method and of 28 lesions using the PCM from 2006 to 2015 and retrospectively reviewed the results, comparing the PCM and the conventional method. The median follow-up period was 35 months, range 2 to 97. Results. There were more lesions at the duodenal angles in the PCM group compared with the conventional method group. 54%, 15 of 28, versus 22%, 4 of 17, and the resected specimen diameter was larger in the PCM than the conventional method group. Median 37 millimeters versus 25 millimeters. Dissection speed was faster in the PCM than the conventional method group, 9.4 millimeters squared per minute versus 65 millimeters squared per minute. En bloc resection was more frequent in the PCM, 100%, 28 of 28, than the conventional method group, 88%, 15 of 17. Perforation was significantly less frequent in the PCM, 7%, 2 of 28, than the conventional method group, 29%, 5 of 17. The one delayed perforation in the conventional method group required surgical repair, while other intraprocedural perforations were treated by clipping. There were no recurrences. Conclusion. ESD of duodenal lesions can be safely performed using the PCM, which stabilizes the tip of the endoscope even in difficult locations.